all stable. In Couva, we have 46. There's been a change in the ICU numbers. Yesterday it was 1, today it is 0. In our high dependency unit, we have 3 persons there, all stable. In the wards where they are able to walk around, these are physically well people, we have 43 people, all stable. At the Sangre Grande step-down facility, we have 28 persons, all stable. And in Tobago, the number remains as 0 persons being treated for COVID-19. I just want to touch briefly before I hand over to my colleague, Dr. Alana Best. Yesterday, one of the questions asked of me was our stock of contraceptives. I did not have that detail on me. I could report today in response to that question yesterday. We have 1.8 million condoms in the country for people to use. That is male condoms. And we have 67,000 female condoms. So I hope that answers the question from yesterday, for which I did not have details. I want to focus on another issue which has been missed in all the talk about COVID-19, and that is the state of our healthcare system. In setting up the parallel healthcare system, we made sure, unlike many other countries, that our normal service to our clients and patients go on unabated as far as possible. I am happy to report the following. In Tobago, the Scarborough General Hospital is up and running. Their 17 health centers are up and running. Their dialysis services are up and running. I'm saying this so people don't feel that they ought not to go and attend to their normal healthcare problems, because we don't want a backlash out of COVID that people feel the hospitals, that other half of the parallel system, is not working. So in Tobago, it's up and running. In Trinidad, all our major hospitals are up and running. Port of Spain, as usual. St. James for chemotherapy, radiation, and so on, not radiation, chemotherapy and so on is up and running. But Dr. Kelly Alain Mike was here and just spoke about how some of the outpatient clinics have been adjusted. St. Anne's Hospital, very important, because we don't want COVID to spread at St. Anne's. At the start of the year, even before COVID, out of the national policy of decentralization of mental health, we have reduced the inpatient population at St. Anne's from 1,000 to 750. So 250 persons less are in there, and they are being treated in their community setting, which is the goal, the objective of a decentralized mental health facility. Port of Spain maternity continues, but Dr. Salian Ishmael was here and spoke about adjustments for outpatient clinics, but we are doing deliveries as normal. So pregnant women, you have nothing to fear. Our hospitals are open. Under North Central, Eric Williams Medical Sciences Complex, operating. Mount Hope Maternity Hospital, operating. San Fernando General Hospital, up and running. Same thing with Sangre Grande. And I want to thank the healthcare workers in that part of the parallel healthcare system for continuing to come out day after day and giving human service. In Trinidad, our 102 health centers, our network of health centers, district health facilities are up and running. The messages, our health system is there for the population who are not affected by COVID-19. A lot of focus has been placed on COVID-19 facilities, but I just thought that today will be a good opportunity to reassure the public to take advantage of our normal healthcare deliveries. It is also a good reminder for patients suffering from chronic diseases, diabetes, hypertension, and so on, to keep taking your medication, look out for your health. One of the major changes that we have made, which was announced, is that elective surgeries will be rescheduled just out of caution. So that is an update on our current healthcare system. I want to deal at this time, if you will permit me, it was raised yesterday about Dr. Tedros' statements about test, test, test. And many people around the world, including Trinidad and Tobago, did not pay attention to the rest of his speech. And I did indicate yesterday that in paragraph 3 or 4 of his speech, after he opened with test, 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 he went on to qualify his statement by saying test, 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 but all suspected cases. I think I have a clip. This is just to reassure the public that what Dr. Tedros said is not test, 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 and test indiscriminately. So if we could put up that clip, I think it will be useful for the public at this point in time.
We have a simple message for all countries. Test, test, test. Test every suspected case. If they test positive, isolate them and find out who they have been in close contact with up to 2 days before they developed symptoms, and test those people too.
Right, so I hope Dr. Tedros' statements, when you take it in the round, let's just repeat. And we have been following that policy in Trinidad and Tobago from the very beginning. Test, 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 all suspected cases, and that is what we have been doing from day one. And Dr. Alana Best, who is here, will go into a little more detail. So I am hoping that that little video clip settles the issue on what test, test, test actually means. Thank you very much, Minister Cox.
Thank you very much, Minister. Dr. Alana Kwamina Best, the Acting County Medical Officer of the Health for the St. Andrew, St. David County, will clarify the concept of a step-down facility.
Thank you, Minister. Good morning, everyone. It is my pleasure to talk with you today about why it is in our national interest to have step-down facilities, to describe to you the care provided at these facilities, and to make some more general comments about our local operations. But before doing so, I just want to follow on from what Minister highlighted with regards to test, test, test. As of today, all our primary care facilities will be doing surveillance testing for patients who may be presenting with acute respiratory infections. Not all of them, but we will be sampling some of those patients just to get an idea of what is circulating in the population. In addition to this, persons meeting the case definition for COVID-19, you will recall many weeks ago, we were testing only persons who had a positive travel history. Now that our borders are closed, we are now focusing on persons who are known to have come into contact with a known COVID positive patient or a probable COVID positive patient. They certainly will be tested for COVID-19. So this is separate from our surveillance testing, which will also be taking place at our primary healthcare facilities. With regards to our step-down facilities, as we are all aware, there are currently no approved medications to treat or vaccines to prevent COVID-19. It is therefore of national importance for our society to put measures in place to limit the potential spread of this disease. Community approaches to slowing transmission, such as social distancing, and reducing face-to-face contact with potential COVID-19 cases are needed to slow transmission and reduce the number of persons who get sick. In other countries, we have seen the use of non-traditional settings to being transformed into care sites. For example, you may notice gymnasiums, stadiums, and hotels. Our approach has been to look for alternative care sites that can serve as step-down facilities that would allow us to shield the general population from directly interfacing with COVID-positive patients and so help to slow the spread of this disease. Step-down facilities allow us to accomplish two important goals. In addition to protecting the general population and slowing the spread of the disease, the step-down facilities allow us to continue to provide supportive care for COVID-positive patients during their recovery phase of this illness. it's important to note that a step-down facility is not a hospital. We do, however, have members of staff who have agreed to live on site with these patients for the duration of their stay. At the moment, we have nurses, a cleaner, and a groundsman at the facility. The patients are monitored twice daily, meaning that they have their pulse, blood pressure, and oxygen levels checked twice per day. We also have doctors on standby as needed. The patients receive 3 balanced meals per day and have access to fruit and water. Patients also have access to outdoors, but obviously within limits, as there are certain areas that are designated for staff only. While the patients are permitted to be outside, they are obviously not permitted to leave the compound. We also understand the importance of supporting the mental well-being of patients with COVID-19, and we have made one-on-one telephone counseling available to the residents at our step-down facility. Obviously, family members cannot be allowed to visit. However, they are allowed to drop off care packages at the designated area to make their relatives' stay more comfortable. To date, the Eastern Regional Health Authority has commissioned 2 alternative care sites. We are all familiar with the Balandra site, which was selected as a quarantine site, and we have subsequently activated the convalescent site in Sangre Grande. The previous site, the quarantine site, allowed us to support persons who had a history of exposure. While there, they were monitored twice daily for the development of symptoms and tested as required. At the convalescent site, convalescence simply means recovery. So while patients are recovering, we know that the persons at these step-down facilities are clinically stable and are awaiting their 2 negative swab tests. When the site in Sangre Grande was activated on Saturday, 11th of April, we accepted 33 patients, and as Minister mentioned, today we have 28 patients at that site. I would like to take this opportunity to thank our healthcare workers, from drivers, laborers, administrative staff, cleaners, pharmacists, public health inspectors, doctors, nurses, social workers, who have all been working tirelessly to support the national response, both to get these facilities up and running and to actually provide the care to the residents there. I'd also like to thank the Trinidad and Tobago Defense Force for their ongoing support as they secure these facilities. And in conclusion, I'd like to reiterate that we are fighting to keep every citizen safe. It is in our national interest to support the COVID-positive patients at these alternative sites so as to limit the spread of this disease within the general population. We have a duty of care to our patients who have been diagnosed with COVID-19 and to provide the supportive services they require while they recover. Thank you.
Thank you very much, Doctor. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. So let's keep this in mind as we begin taking your questions. I-95.5.
Yes, good morning to everyone.
Good morning.
I have 2 quick
Good morning.
questions. Are the authorities monitoring ex-COVID positive patients after their discharge to try to gather any epidemiological data so that we can better understand the virus? And my second question is if they can provide us with some advice as to how we can handle someone who is COVID positive in the event of an emergency. So for example, a fire or an earthquake and you need to get out quickly and you don't have time to don your PPE. Is there any particular advice for persons in such situations? Thank you.
Thank you for the questions. With regards to follow-up, Once we have made the diagnosis of COVID-19, a detailed history is taken from the patient, and we then make the epi-links in that way. Once they have fully recovered and they have their 2 negative swabs, we do continue to make contact with them through our surveillance teams for further 7 days via telephone to make sure that they continue to self-isolate while at home, and also just checking in on how they're doing psychologically and physically. With regards to your second question, I'm afraid I'm going to have to come back with an answer for that. You do raise a good point in terms of what happens should an emergency arise. Certainly our patients who are COVID positive at our facilities already are wearing their PPE at all times, so that should an evacuation need to occur, our staff can continue to give directives at a safe distance while the patients are ushered out in a safe way. Certainly the facilities that we do have would have safe spots, muster points that patients can go to in the event of a fire or some other kind of disaster.
Let me just come in here on the ministry's perspective on ex-COVID patients and monitoring. We have linked up with the University of the West Indies through our monitoring and evaluation department at the ministry to do just what was suggested, because we do have to collect on a national level the epidemiological data, and the University of the West Indies together with the Ministry of Health will be doing that. So that lends some more clarity to the issue of follow-up. Thank you.
Thank you very much. 98.1.
Good morning, Stephen Cummins.
Morning, Mr. Cummins.
Good morning.
Mr. Minister of Health, just 2 questions quickly. Minister Dayal Singh, you said in a previous conference that government was in the process of seeking foreign experts, expert advice, a team of persons on helping the government to better understand COVID-19. Has there been any further progress on that? And second question, have the additional promised ventilators arrived as yet in the country? And what would now be the total also PPEs?
Sure. So let's deal with the foreign expertise. Yes, we have reached out to the United Kingdom, the United States. We also the Chinese embassy here has a series of virtual meetings with the health professionals in China so we could learn from their experience. So the answer is yes, we have reached out to foreign experts. The number of ventilators currently in the country dedicated to COVID is 69. And yes, more ventilators did come in, 17 at Point Fortin and 15 at Arima. Originally it was, I believe, 52. We are now up to 69, and that is where we stand now with ventilators. Once flights come in, because I always have to qualify, once flights are able to come in, we have an additional 10 coming in this week. 6 will be earmarked for the Augustus Long facility, and 4 will be going to Tobago. Tobago currently has 5, and we'll be boosting them up to 4. So that is where we are with ventilators right now, which is more than enough right now. Thank you very much, Mr. Cummins.
Thank you. Newsday.
Hi, good day, Mr. Minister. Shane Superville from the newspaper here.
Good morning.
Morning, sir. I have 2 questions. The first one, during the correspondence with foreign healthcare professionals, as the topic of the latest 3 coronavirus victims come up, any point, do we understand or better understand how they were able to contract the virus seemingly after the incubation period of 14 days? And the second question, just to piggyback off of the issue of the contraceptives, in addition to the condoms, are there diaphragms and pills for birth control available as well?
Okay. So the issue of the 3 patients, that will be addressed by the Chief Medical Officer tomorrow. Some early indications could be it's a false positive, but we don't know for sure as yet. And I did confirm that many countries around the world are getting small percentages of this. It's a new virus. We are part of a global pandemic, and all the answers aren't in as yet. On the issue of diaphragms, again, I wouldn't have that level of detail off the top of my head, but my CorpCom person is here, and she's listening to the question, and will take a note. You want to know how many diaphragms? What again? Shane?
Yes, do you hear me?
Yes. What other information you want? Numbers of diaphragms? What again?
Birth control pills as well.
Okay, so my CorpCom person is here, and she will find out. Thank you, Shane.
You're through?
Yeah.
Okay, we move to AZP News.
And Gael, good morning, Minister Cox. Morning, Minister Dial. Say morning, everybody.
Hey.
Good morning.
Errol Fabian here representing Gael and AZP News. Two questions. Firstly, for the Minister of Health. It is good to hear that we've released part of the population from St. Anne's Hospital. However, if they are to seek medical attention outside at the health centers and so, depending on the degree of the mental health issue, some are not able to responsibly navigate out there with respect to masks and touching and sanitizing. What is happening at the health centers to assist with that? Or is there some sort of assistance with respect to home care that families can expect?
Okay, thank you. Thank you, Errol, and nice to see you. So part of the National Plan for Decentralization of Mental Health is to put mental health where it ought to be. This was a plan developed since the 1960s, back into the community. Dr. Hazel Othello was here last week, and she explained in detail what services are available, how they can access those services. So I would not like to go over the technical presentation, but rest assured, Dr. Hazel Othello, who is the National Director of Mental Health, driving the decentralization process, did give a very detailed presentation, I think, week before last. For the issue of masks and home care and so on, we have engaged the services of a non-profit organization, FEEL, who will be driving the national response in terms of masks and so on. To the issue of home care, I will have to get back to you on that. I will ask Dr. Othello, or maybe ask Dr. Othello to come back because it's an important topic and further explain and clarify. Thank you very much, Errol.
Thank you. Peter Christopher.
Hi, good morning. Good morning, Minister.
Morning, Peter.
I have a couple of questions. Just also a point of clarity, as you mentioned that the operations at most health facilities would be operating as normal. I think early on, some clinics may have been cancelled because of the restrictions put in place. Are those clinics still operational, or are there still some clinics that would be sidelined because of the restrictions in place?
Sure. So as both Dr. Surju Singh, who was here yesterday, Dr. Salian Ishmael, who was here earlier, and another doctor who was here, Dr. Kelly Allen Mike, those three did speak to the issue of what clinics have to be adjusted, why they have to be adjusted, and what steps are in place to reach out to our patients to make sure they are not unduly inconvenienced. So I can refer you to those three earlier presentations, and that is why we are saying today our health system is up and running, but at the healthcare level, as I said, we have cancelled some elective surgery because some adjustments have to be made. Dr. Kelly and Mike did go into detail as to how outpatient services have been adjusted to take care of our cancer patients. I can refer you to her earlier presentation. And Dr. Adesh Surju Singh, who was here yesterday, and Dr. Salian Ishmael. So I can refer you to their earlier presentations. But by and large, we continue to encourage our population to use the public health system. Don't stay at home and let your chronic conditions worsen. That's a good message to get out, and I thank you for the question.
Okay, I think Peter had another question, or both questions were answered?
Question. I have another question. Well, I also asked on Sunday about the epidemiological review. I'm tripping over the word.
That's all right.
I wanted to find out if there had been any update with regards to those investigations. I believe there were 4 or 5 pending. And another question with regard to a social media post that was picked up on by one of your parliament.
Peter, hold on. You're entitled to 2 questions, all right? I see you have much more than 2. So we'll just take the first one, the second one, please.
So,
okay.
Thanks, Peter. As one of your colleagues earlier this morning, we did indicate that we have reached out to the United Kingdom, the United States, and China, countries that have much more cases than us, to try to assist us with this anomaly. No one can pinpoint exactly what has happened. In talking to the chief medical officer this morning, it seems to point to possibly, we don't know, this is new. Many countries are feeling their way around this issue. We don't have all the answers. No one in the world has all the answers at this point in time. So we are reaching out as wide and far as possible to assist us. Thank you very much, Peter.
Okay, I believe I went ahead before the second question was asked or answered to AZP News. So we go back to Gael and AZP News now.
Thank you so very much, Minister Cox. The second question is really for the Minister of National Security, and I'm really saddened that he's not here this morning. The question is, when will our nationals be brought home? The airport clearly is not closed. There's a WestJet flight leaving for Toronto today. Repatriation flights are happening from time to time. We had a foreign head of state Acton visit, and we have nationals at the consulate in Suriname. They're not hearing anything from the Surinamese government. They're not hearing anything from here. We have nationals in Barbados. When are we going to bring our nationals home? And it's not enough for us to hear that is up to the medical team. It's the Minister of National Security who has to make that decision. We would like to know when will our nationals be brought home.
So I will make sure to send your concerns to Minister Stuart Young. He was here as early as last Friday or Saturday, I believe, and he gave a detailed explanation. But I will certainly pass on your concern to him so he can address it. Thank you very much, Errol.
Thank you. Loop Titi.
Hi, good morning, everyone.
Good morning.
Okay. Minister Dayal Singh, I remember you saying that government was trying to be very careful with bringing the hotline on stream. How has it been faring? Have we increased capacity, and do we know when the app will finally be launched?
So yes, we did increase capacity from 10 to 18. The number of calls, I am told, is starting to go down. We are getting more serious calls. On the app, I spoke to the PS this morning. Google, we had submitted it. Google had told us initially 7 days. It is now 9 days, but I think they are swamped. So we did speak about that app this morning. So as soon as I have a firm date and it's up and running, I will surely let the country know. Thank you for the question.
Astronaut News.
Morning. Good morning. Bernard Stewart from Astronaut.
Good morning.
Good morning.
My question is to Dr. Dayal Singh.
Mr. Dayal Singh. Mr. Dayal Singh.
Mr. Dayal
Yes,
Singh.
yes.
Thank you for the update on the state of the healthcare system. And have we been keeping tabs on the number of cases of H1N1? And if so, how many cases have we seen in recent months?
Okay, so we don't have accurate figures of H1N1. Sorry, we don't have real live data on H1N1 because many people will have it and not even know they have it. What we have is actual data on vaccines. The last count I had, and I must admit I didn't pay attention to that, Corpcom is here now, and if they can get the number of vaccines delivered, I could give it during the course of this transmission before we close. So I'll work on that now to get you the number of vaccines given out since the flu season started last year, October, November. So expect an answer in a few minutes. Thank you very much.
Power 102.
Good morning, Hatibel.
Morning.
Good morning.
I just have one question for the Minister of Health.
Please identify yourself, please.
Oh, sorry.
Thank you.
D'Souza, social media. I just have one question for the Minister
Sure.
of Health. And the Cuban nurses that we're supposed to be bringing in. But I know yesterday we discussed the idea that a lot of local nurses want to be employed and they have not been employed as yet. So do you think we should still bring the Cuban nurses given the fact that we have local nurses here who are unemployed and are willing to do the job?
Yes. So the issue of Cubans is one that needs constant explanation. We don't bring in Cubans to take the place of citizens of Trinidad and Tobago. We bring in Cuban nurses and doctors where there is a shortage of a specialty. So, for example, we have a shortage in Trinidad of maxillofacial surgeons. So you might bring in a Cuban to do that. We have a shortage of ICU trained nurses. That is where the Cuban nurses will come in, because you have to have specialist training. And what we are doing at the same time is ramping up our postgraduate training in ICU. So we don't bring in Cubans or other persons to take the place of Trinidadians. We bring them in where there's a lack of a specialty in Trinidad and Tobago that can't be filled. Okay? Thank you very much.
CNC3.
Hi, morning everyone.
Good morning.
Morning.
I just have two questions here for you, both for Minister of Health, Terence Yalsing.
Please identify yourself.
Rashad Khan, Guardian Media.
Sure.
Hello?
Yeah, sure.
Yeah? Okay, sure. So the first question is, surveillance testing was supposed to begin today at one health facility in each county. I'm just wondering, I know it's early in the day yet, and it would have only just started, but if we could get any updates on it, if anyone has been tested already, and if these figures would be provided within the updates, the daily updates that we get, or as a separate category within those updates. And my second question is, has the ERHA chair reported back yet on the facility in Sandy Grande? And within that question, how do you respond to reports in a local newspaper today that the facility in Brooklyn Settlement is owned by a Mr. Davis, someone who has alleged close PNM ties? Also, we are hearing that the facility isn't as good as the Balandra one, yet we are paying $20,000 more for it a month at $105,000.
Okay, so let me answer your questions. The surveillance testing just started today, Rashad, so I wouldn't have any data on that. But I think it will be useful in a separate line in the 3 daily reports that we do put out, as long as the data starts to come in, that we could be included. The report from the chair of ERHA, as I indicated yesterday, is due in 48 hours. 48 hours expires tomorrow. As to your claim about Mr. Davis, I don't know Mr. Davis. That arrangement was done between ERHA. So I suppose all that will come out in the report. Okay? Thank you very much.
Okay, TV6. TV6. Okay, while we wait on TV6, there's a question for the Minister.
Yes.
This is from Radio Tambourine.
Sure.
Can the Health Minister advise on what's in place, if anything, for blind or other disabled persons if they were to contract COVID-19 in relation to the blind persons needing space or needing someone to assist them? What's in place for that?
Sure. So what we will do with special populations, so yesterday again we spoke about a pregnant person who is a special population. We will try to make every effort to accommodate people with special needs, whether they are blind or disabled, at our facilities to give them the maximum amount of assistance and help that they will require at this point in time.
Okay, I'm checking to see if there's anybody else, any hands up. I'm not seeing any more hands up. So TV6, is TV6 ready? No, it seems not. So I'll now like to ask the Minister of Health, the Honorable Terence Yalsing, who will now give us a closing statement.
Thank you very much. I just want to read one item from a newspaper this morning. It's from the Express. One big happy family in Grandy. And this person who spoke to the journalist is Ricky Ramdas, said this to say, "Let me say this. If you have 30 people together and you ask what conditions are like, you might get 30 different answers. There must be some negativity in between, but I am telling you, we have absolutely no problem being here." As she spoke, voices in the background were expressing their agreement. The woman added that patients were free to venture outside, unlike other hospital facilities. This is the truth coming from a patient. I think the patient also spoke to the media last night on one of the TV stations. So I want to give the population the reassurance that the Ministry of Health will never purposely discomfort any patient recovering from COVID-19. We understand their frustration. The biggest complaint coming out of Sangre Grande is that they want to go home. And I could understand that. They have been to hell and back. And they need our support. And the Ministry of Health will do everything possible to support them in their time of need. Ladies and gentlemen, we are part of a global pandemic. Very often, rules have to be made up on the fly. The best of preparation from January to now, there will be some areas for improvement. And we continue to learn, but the message that has to be left here as we prepare for the second wave of infections is simply to stay home and stay safe. The Honorable Prime Minister has been leading this country magnificently, step by step, taking measured approaches, measured but robust approaches since January 30th. The government, the Prime Minister, has the best interest of all of us at heart. And if we stay home and stay safe, we will come through all of this together. Thank you very much.
Thank you very much, Minister. And we have come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. The Ministry of Education will be hosting a virtual media conference at 2 p.m. today, so please tune in as they update you on the way forward for education in this time of COVID-19. I am Donna Cox, Minister of Communications, and thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe, and may God bless Trinidad and Tobago.
Taj 92.3 FM, we sound better.